Hepatitis, particularly B and C both, they are also taken as a stigma in the society. Because of that, many people don't want to visit the hospital. 95% of those who are infected, they don't know that they are infected. And second, 95% of those who are infected, they don't have any symptom. And by the time symptom develop, then we don't have anything to do. Not much is left to do actually for the patient, because patient would already have developed cirrhosis. It is not that they don't have access to the hospital, they don't have money. They have all the facility, but they don't want to visit because their privacy will be disclosed.
Those gaps which have been there in the elimination of hepatitis C, which we are trying to fill, and one of them is basically the testing system.
The person who wants to get tested has to visit a healthcare center or a laboratory to get himself or herself tested. That was a major bottleneck. And obviously it is not an easy job for healthcare system to approach 1.4 billion population in our country. So self-testing is the only solution which is available to us.
So this proposal for self-testing kits for viral hepatitis came to us from SGPGI and KGMU, and they told us that they are planning to do some field interventions, field level testing with support from PATH. So that is how we got involved with PATH in this particular project.
HCV self-testing refers to a self-care approach which allows people to test for the disease on their own and find out the results at a location of their convenience.
If you talk about prevalence, it is very much different in different geographies of the state. In Western UP, the prevalence is very high, whereas in the districts of Eastern UP, it is relatively on the lower side. But then one reason might be, we have better diagnostic capacities in the Western UP, so we are getting more cases.
Mizoram has a very high incidence of hepatitis C amongst the vulnerable population, especially among the injecting drug users. So identifying new HCV cases and those requiring treatment is a major challenge.
The incidence or the prevalence of hepatitis C is very widespread in this community of Mizoram because we have a very high incidence of IV drug abuse.
So one of our initial steps was conducting the formative assessment. We conducted focus group discussions and the in-depth interviews and the key informant interviews to identify the perspectives of the stakeholders.
We had held a pre-orientation workshop with all the partner medical college and the district hospital. We had invited the head of departments of all the departments like gynae and dentistry and gastro and nephro and medicine, micro, the blood banks.
The next step was to involve the stakeholders, getting collaboration done with the stakeholders and keeping open communications and having regular meetings that helped us in strategizing our task.
We also had a meaningful community engagement by having a community advisory board at Mizoram and Uttar Pradesh. We had a very regular quarterly progress and review meeting of the project, and also study findings have been shared with them.
At here ang kan chuka tin office hian duang to kalak turom wang hian angkol to wang hian antinan samaritan lamani mo shalom lama PE mo peer educator mo peer mobilizer po ni se kha haute po kha kan pe kwal ta te kan sem tara zon bun har se zon chutala zon mulai thlen lo du lova thlenin pokot moni
helai muna self test kit mga ron in test reactive ta follow up ngai te hi am boi thak thei em a confirm tura biak po le kaukal hi an har em a takniel po har takania
जो हमारे आईडीएस भाई हैं हॉटस्पॉट पे हम जाते हैं, उनसे बातचीत करते 1-to-1 के माध्यम से। और जब ऐसे लोग बताते हैं ये कुछ, तो उसके बारे में उनको वीडियो दिखाते हैं, हेपेटाइटिस सी की वीडियो ये है, उसको समझाते हैं उसके बारे में कि इसका इलाज कैसे होगा, इसका क्या दवा चलेगी, इसको कैसे रोका जा सकता है, उसके उपाय और सब चीज़ बता के उसको ब्रेक कर दो। उसके बाद अगर कोई ऐसा रिएक्टिव निकलता है तो ला के उसको अपने DIC पे उसकी जांच कराते हैं डॉक्टर के माध्यम से और उसकी दवा चालू कराते हैं।
प्रॉब्लम सबसे बड़ी यही रहती है कि ये पेशेंट जो पार्ट टीम या जो आप लोग काउंसिल करके उनको लाते हो, तो जब उनको हमारे सिस्टम में OPD में वो आए तो वो उतना मोटिवेटेड नहीं होते हैं जैसा बीमार आदमी होता है, बिकॉज ये पेशेंट बीमार तो होते नहीं हैं। पॉजिटिव पेशेंट को बीमारी होने में 15-20 साल लगते हैं। तो बीमार आदमी तो मोटिवेटेड होता है, उसको तो ट्रीटमेंट कराना है, लेकिन एसिम्प्टोमेटिक पेशेंट, वो पेशेंट OPD में आए, लाइन लगाए, जांचें कराए, फिर ट्रीटमेंट के लिए आए, मल्टीपल टाइम उसकी विजिट हो, तो ये थोड़ा डिफ़िकल्ट है।
Testing is necessary, but at the same time, once we started testing, we should also look for the management. So the final end goal is also important because after all, we are taking care of the patients. So if we are testing, we have to look out for the treatment and even for the monitoring of the treatment as well.
The most important thing is that if you brief the districts well and if your team is active, you can conduct very good quality studies in a very brief period of time. So that is the biggest learning. If you are thorough in your preparation and if you brief the districts well, if you brief the partner agencies well, and the logistics are available readily and the required HR is there, then you can conduct good quality studies in the state.
My suggestion would be maybe using this, they go ahead and find certain in all over India or other states and start off like a pilot project, and then who are positive in that area tie up to the viral hepatitis centers so that they can be provided the medications. The more you treat, not only you're treating this person, you're also decreasing the risk of spreading the disease.
They are happy, they are accepting it. If people accept it, we can send it by post and they will simply test it, and if those who are positive, they can contact the healthcare center and get themselves treated and get rid of the disease.
PATH has supported confirmation testing of all those who have tested reactive with subsequent viral load testing, baseline testing of patients and treatment support to ensure that HCV positive patients are linked and initiated to treatment.
We are very thankful especially to PATH for collaborating this particular study with Mizoram Medical College, and the insight of this particular study will help not only the state of Mizoram in terms of diagnosing and treating the patients of C hepatitis, but also taking the insight from this particular study, they will be able to imply it across the country.
On behalf of PATH, I would like to thank Unitaid and PSI for supporting this initiative. I would also like to thank all the efforts and collaborations from the National Viral Hepatitis Program and the State Viral Hepatitis Program in Uttar Pradesh and Mizoram. A special thanks is due to our collaborative and implementing partners. We hope this work will strengthen national government efforts on early testing, treatment and elimination of viral hepatitis by 2030.